Promotion and Risk Reduction Through the Lens of Public Health by Diane Walter. Yuma is located in the southwest corner of Arizona. It has a colorful history, which lives on today. Saddle up for an adventure in providing public health services. This is Diane Walter speaking with Miss Diana Gomez, who is the Director of Public Health for Yuma County. She will share the public health mission statement of her organization, as well as describe briefly the social ecological health model.
Hello. The Yuma County Health Services mission is to provide services that prevent epidemics, the spread of disease, protect against environmental hazards, promote and encourage safe and healthy behaviors, as well as assure accessibility to health services. And we do this through three core functions: assessment, assurance, and policy development. We have several divisions in our agency that focus on making sure we reach these goals. And our health promotion agency piece of it focuses on creating promotion programs that we use in the community to promote healthy behavior. Now, a model that we commonly use is the social ecological model framework, and we do that because it's a very valuable framework in the sense that it encompasses or allows us to focus on various factors such as individual, relationship, the community, and societal factors that contribute to lasting change.
Diana Gomez, the Director of Public Health, stated that there were three core public health functions: assessment, policy development, and assurance. There are also essential public services within those three functions. For assessment, we have monitor health, diagnose and investigate. Under policy development, inform, educate, and empower, mobilize community partnerships, develop policies. And then under the assurance, we have enforce laws, link to and provide care, assurance of competent workforce, and to evaluate. According to Yuma County Community Health Assessment, the leading causes of morbidity and mortality in this county include preventable chronic diseases such as diabetes, cancer, respiratory, and cardiovascular disease. The community professionals here have identified that the Hispanics, Native Americans, migrants, and farm workers are the subpopulations at risk for these chronic diseases. To explain more about the social ecological model, that is used by Yuma County, we will present it by focusing on diabetic self-management care. The social ecological model is based on the social ecological theory, which addresses complexities and interdependencies amongst the social economic, culture, environmental, and psychological detriments related to health. The social ecological theory proposes that individual behaviors are supported and influenced by numerous other systems and groups. The levels of influence in the social ecological model include individual, which is intrapersonal, relationships, which is interpersonal. Then we have community, which is also organizational. And then we have societal, which is the policies. Yuma County public health practitioners have used the social ecological model as a planning tool to select what health promotion strategies would be effective in promoting community health by looking at inner and outer levels of support for the individual and the population. As part of the planning tool, they've conducted needs assessment, set health priorities, diabetes being one that we will focus on, research factors, the social and environmental, look at the community resources, and then the associated costs of trying to implement. Also, consult on evidence-based practice resources, programs, policies, services that are already known to improve health and utilize those, as well as the implementation phases, accessibility, acceptability, and feasibility. The picture you are seeing right now is a conceptual framework of self-management of type 2 diabetes using the social ecological model. It has been adapted from Ansari, Dixon, and Browning 2013. It begins with the 4 levels of individual, relationship, community, and societal. We have using the type 2 diabetes management for the population of Yuma County. And in that, we have the education, employment, and poverty that we need to know, and critical covariates are race, age, and sex. Also, the health behaviors, monitoring their hemoglobin A1Cs, adherence to diet, physical activity, access to health care, primary care, providers, health care, specialty visits, and the process of doing the hemoglobin A1C measurements and the use of medications. Health outcomes is, of course, to decrease mortality and morbidity, as well as obesity and CVD. Primary outcome is to lower the hemoglobin A1C. Inner outcome is to be watching the blood pressure, the BMI, and the quality of life. To help the residents of Yuma County, the public health nurses were very instrumental in going to the convenience stores that were on the local corners here and encouraging them and having discussions about having healthier food choices to be offered, which the corner convenience stores here have accommodated that and do have better food and healthy choice foods now. Also, they have been instrumental in getting the walking and biking trails throughout the community established and maintained, and they continue to provide education, do screenings, and follow-up monitoring at the health department. A picture's worth 1,000 words. Special thanks to the Yuma County Public Health Services District for being champions of change and promoting healthy living in Yuma County.